Concerns about measles keeps rising as more people around the nation and around our area get sick. WFMY News 2's Joseph Leonard spoke with local experts about the risk to the Triad.
The CDC has reported 361 measles cases across the U.S. this year, and with vaccination rates dropping to a 5-year low in North Carolina, Triad doctors are pushing parents to get their kids vaccinated. Doctors say measles starts with a fever and a running nose. The virus causes rashes across the body, attacks white blood cells, and weakens the immune system.
It is one of the most contagious infectious diseases that we know of.
It can live in the air for 2 hours. So if someone walks into a room with measles, breathing, and you walk in 2 hours later, you are exposed.
But doctors say less and less people are protecting their children against the virus. The CDC says North Carolina measles vaccination rates are at its lowest point since 2019, a trend doctors say started with the COVID-19 vaccine.
Since COVID, we have seen more vaccine hesitancy. That being said, every other vaccine has been in the process of study for decades. Even the new RSV vaccine that kids started getting in the past year or two was in development for 15 years.
Doctors fear that drop in vaccinations help fuel this year's outbreaks, but for some parents, the rise in cases is a wake-up call.
What I am seeing is parents worried and trying to get that vaccine earlier.
The biggest concern, measles isn't just a common cold. If untreated, it can turn deadly.
The risk of developing what we call encephalitis or inflammation in the brain. There can be permanent brain damage from that, and children can also die as a result of those complications.
Luckily, there have been no outbreaks reported in North Carolina this year, but doctors say with spring break right around the corner, it's a great time to get your children vaccinated.